Hi, my name's Michael Archer, and tomorrow it's my first day working in an intensive care unit looking after coronavirus patients who are ventilated. So at the moment I work in the private sector as an operating department practitioner. As you've seen in the news, there's been a contract signed for the private sector to work with the NHS at cost. So there's work going on in my hospital on behalf of the NHS, but what I've realised through some of my colleagues in other hospitals is, although there's been a fantastic drive to make more ventilators available, there is a shortfall in staff, partly due to opening more beds and partly due to sickness and people isolating. I can't comment on whether lack of testing has got anything to do with that. I don't know the full picture yet. I just know that my colleagues in some of the NHS hospitals are starting to struggle. And as I have skills that are applicable to intensive care units, I thought my skills would be best utilised outside of my current job. So my employers have very kindly allowed me to volunteer, and although I'll be continuing to be employed in the private sector, I'll be able to work in an NHS hospital. So hello again. As you can see, I'm significantly smoother and bolder now, and anybody who knows me will tell you how much I hate being clean shaven. But unfortunately that's what I have to be now. Tomorrow morning I'm starting work at 6:30, and the only thing I really know is that I'm being fit tested, which involves making sure your PPE works correctly and seals around your face. Other than that, I've been on intensive care units before, delivering patients after their surgery. I don't really have experience in looking after sick people on the unit. I have had a very basic introduction to critical care nursing from one of my colleagues, which was interesting. Made me realise there's a lot more to this job than I thought. Everything from brushing teeth to suctioning airways. I've got a lot to learn tomorrow. So how am I feeling about tomorrow? I did say earlier I was pretty terrified. Now I'm just feeling nervous. Not worried too much about being around the virus. I know how to use the PPE. I have a previous experience of working in PPE. More just nerves about the seriousness of the role and whether I'm up to it, which I've been assured I am. But as I said earlier, I've a lot to learn in as short as time as possible. So yet there's plenty of people all over the country in exactly the same position as me, and that's one of the reasons why I wanted to tell my story, is just for all the negative press out there at the moment about people wandering the streets, not self-isolating. For every one of those, there's 10 people who are working their socks off for the British public, and everyone, it's just all hands to the pump at the moment. Doesn't matter if you're a private sector, NHS, agency, everyone's out there doing jobs that they probably never thought they were going to do, but everyone's stepping up. So I will speak to you tomorrow when I'll no doubt have some more to talk about. Cheers.